Did you know one woman dies every 13 minutes from breast cancer? This year, almost 250,000 new cases are expected to be diagnosed in the U.S. Breast Cancer Awareness Month is the perfect month to highlight hereditary cancer risk assessment and an exciting new genetic test called Risk Score, a personalized medicine tool designed to predict a woman's 5-year and lifetime risk of developing breast cancer by combining genetic markers throughout the genome with her family and clinical history. Dr. Ora Gordon is here to talk about the Risk Score. Good morning, Dr. Gordon.
Good morning.
Which women are candidates for hereditary cancer risk assessment and genetic screening for breast cancer?
The most essential tool is actually knowing your family history and knowing the family history of cancer. There's a lot of misconception. People think that to be at hereditary risk there has to be tons of breast cancer in your family, or that your father's family history of breast cancer doesn't have an impact to you as a woman because it comes through your dad. And neither of those is true. In fact, just having one family member with breast cancer under the age of 50 or one family member with ovarian cancer at any age, it makes you eligible for hereditary risk assessment and genetic testing.
And could you tell us exactly what is the Risk Score test and how is it different from other hereditary cancer tests like the MyRisk hereditary cancer test?
Sure. The Risk Score is really a breakthrough in personalized medicine and will transform breast cancer risk assessment for women with a family history of breast cancer. The hereditary cancer panels like the MyRisk is a test that looks at genes like BRCA. The BRCA genes have been discovered for over 20 years. We've had tremendous advances that allows for much more efficiency and the ability to test for multiple genes at once. But 90% of women who undergo that genetic testing, we don't find a mutation. If there's a known mutation, we have a clear roadmap on how to take care of those women. But for those 90%, this Risk Score now combines novel genetic markers with that family history and that individual woman's reproductive risk factors to give her a lifetime risk for breast cancer that can then tailor how best she should be taken care of.
How do Risk Score test results guide your treatment decisions and help those patients?
So the Risk Score comes back with an absolute number, and if your risk for breast cancer is 2 or 3 times elevated over the population risk for breast cancer, then you qualify for enhanced surveillance. So in addition to your mammogram, for example, you would have a breast MRI, a specialized imaging test of your breasts to detect the earliest changes for breast cancer. You would be eligible potentially for medication, a pill that you could take every day that might reduce your risk for breast cancer by 50%. In addition, optimizing lifestyle, the ideal body weight, reducing alcohol if that's an issue. These are things that can empower women to make their own changes to help prevent breast cancer. And if indeed they're at average risk, they come back to be not at elevated risk despite having the family history, then they can be unburdened not only from their family history, but also the excessive tests and evaluations that a woman who is at high risk needs.
And doctor, where can people find more information about the Risk Score test?
So for the Risk Score test, I would recommend people go to the Myriad website at myriad.com, but I really want to empower your viewers to get their family history information, take that to their doctors. If you think, gee, maybe genetic testing is appropriate for me, take the hereditary cancer quiz. HereditaryCancerQuiz.com can give all kinds of good information about whether genetic testing is appropriate as a first step for prevention.
Dr. Ora Gordon, thank you so much for joining us this morning with some great information.
Pleasure, thank you.